Yes, chiropractors use x-rays out of necessity. The thing that's most important is to identify the positions of the structures involved. If you're taking a picture of your lower back, you want to make sure your hips are level, you want to make sure your spine is not curved, you want to make sure that there's not having degeneration or big bone spurs, and that helps to visualize what the correction that's needed, or the correction that's needed. Chiropractors are not the only ones who use x-ray. It's important for us to see, as I mentioned before, what the structure looks like. Orthopedic surgeons use x-ray or then on top of that CT scans or MRIs in order to identify the significant problems in the spine. A doctor of chiropractic can see disc degeneration, but an orthopedic surgeon uses that as a stepping stone to find out the depth of the degeneration in the discs or the bone structure itself. Just like a dentist would always use x-ray to determine which teeth need to be worked on. As a matter of fact, no, they don't. First of all, it may be a matter of some chiropractors can't afford to use an x-ray, or other chiropractors have a close relationship with their neighboring x-ray facility or a hospital where they could send their patients to get x-rays if they feel like it's necessary. Funny thing is, when I moved here to Brady, Texas in 1998, I was the first chiropractor to ever have an x-ray in his office. Everybody else just either referred them out or just went on touch and feel, which is not always accurate. The most important thing is ruling out other conditions that can be present that you would have no idea if you hadn't taken an x-ray. I've seen x-rays with severe degeneration. I've seen curvatures that are changed dramatically. I've seen tumors evidenced on film and have had to refer the patient out to an oncologist or a radiologist to review the film to say, yes, that's a tumor, you need to have something done about it. So not only, and there's one other thing that actually can be very severe, which is an abdominal aortic aneurysm. That is a death-defying situation, because if that aorta becomes punctured by the spine in a severe adjustment by someone who doesn't know it's there, it could burst and the person would die from bleeding out. Those are very dramatic examples, but they're very important to know that you don't have to deal with that when you're just adjusting the person's body, trying to correct the misalignment. Not 100% of the time, because when you take a history of the patient as they come in, you might find that they have no trauma, which means there's not been a traumatizing incident that could have caused problems for the spine, but also they have a very mild history. They have a great examination where their range of motion is full and they don't have any positive orthopedic or neurologic tests. So there's some reasonable safety in adjusting that type of person who presents that way without an x-ray. But surprisingly, I've seen many of the people that I thought, well, this is a simple case. We take an x-ray and see a variety of misalignments or degeneration or other things that need to be dealt with.